Good morning, everyone, or good afternoon, depending on where you are when you're watching this video. The other day I was reading an article, and the article was about chiropractic, and the reporter definitely had an agenda, a slant to the article that she was writing. She was talking about some chiropractors who take care of patients for health reasons. And, that's what I do. And it's all because we teach you about how the nervous system controls health and function in the body. And if the nervous system isn't working properly, then the body can't function as well as it should. And yes, chiropractic is about aches and pains of the muscles, and it helps with neck pain and back pain. And that's what drives people to come to the chiropractor's office. But once you're in that office, it's the chiropractor's responsibility to let you know the effect that the back pain and the neck pain related to your spine has on your overall health. And there's a lot of chiropractors who don't practice that way. They're just strict musculoskeletal chiropractors. All they do is take care of the pain and then send you on your way. Whereas the majority of chiropractors have a holistic approach, a whole body approach to healthcare. And where this comes from is the subluxation. And this is what I'm going to talk about in a second. The subluxation is the misalignment in your spine. And when that vertebra misaligns, three things can happen. One, there's an effect on the muscle, an imbalance, an instability effect, which then gives you ache, pain, and restriction of movement. Two, when the bone's left out of place because it's not in the right position, it causes friction. That friction over time, like me rubbing on my hand like this, wears down the surface of the bone, and that causes arthritis. And third, the most important thing is the neurological effect. When the vertebra goes out of alignment, it alters the shape of the opening where the nerve comes out of, and that puts pressure or irritates the spinal nerve, which disrupts neural impulses. The neural impulses that come from the brain down the spinal cord are what control your entire body's function. Everything from your heart beating, to your lungs breathing, to your stomach digesting food, to your immune system working properly. It's all controlled by the nervous system. So neural impulses are extremely important. So that's the basis of how I treat my patients. Yes, I'm trying to help you with whatever you came to my office for, but the other major effect we're having is reducing neural impulse blockages, which improves nerve flow, which helps your body function better, and in turn helps you to be a healthier, better performing person. So the slant of the article was that when the reporter was sort of disparaging these chiropractors for having this take on healthcare, naturally she went back to 1895 and the early 1900s, when chiropractic was in its infancy, and we talked about subluxations all the time in chiropractic, and they advertised, treating health conditions like high blood pressure and dysmenorrhea and digestive issues. So back then it was commonly associated, people would think that chiropractors think they can cure disease, and they think subluxations are the cause of all disease. So that was the premise of this article, is the woman was quoting text from the late 1800s talking about how subluxation was the cause of disease, subluxation was the cause of illness, subluxation was the cause of health conditions. And then while she did that to try to disparage chiropractors today, the fact of the matter is that wasn't accurate then, and it's not accurate now. Subluxations have never been thought of as the cause of disease. What subluxations have been thought of and researched to be was the cause of nerve pressure. That's it. Subluxations cause nerve pressure. Subluxations decrease neural impulse flow. That's what subluxations do. Then whatever happens after that nerve pressure's there is up to the individual body. So if you realize that nerves go everywhere in your body, like we talked about, to your heart, your stomach, your liver, your kidneys, your bladder, your reproductive organs, your immune system, everything, then nerve pressure over time can decrease function in those areas, and then health conditions can occur. Now, did subluxations cause the disease or the illness? No, subluxations cause the nerve pressure. And decreased nerve flow over time can then lead to decreased function, which then in turn can turn into a disease. So the reporters in the medical profession back then, and even today, as evidenced by that article, like to say that chiropractors think they can treat disease because they think that subluxation is the cause of disease. So I just wanted to reiterate, in case you ever read an article like that, that chiropractors don't think that. You know, chiropractors think that subluxations are a misalignment of the spine that causes a muscular imbalance, which leads to ache and pain, causes friction on the bone, which can lead to degenerative changes, and most importantly, it alters the shape of the opening the nerves come through and puts pressure on the nerves, disrupting nerve flow, which then in turn decreases your health. So chiropractic's main function is adjusting the spine, and as we're adjusting the spine, we're taking pressure off the nerve so that nerve flow can go out to the rest of the body and your body can work properly. We're reducing friction on the bone so we prevent degenerative changes from occurring. And then lastly, we're balancing the musculature. We're creating stability in the joint, which then helps take away your ache, pain, and restriction of movement. So chiropractic has never claimed to be a treatment of disease, despite what you may hear if you read disparaging articles. Chiropractic is just a way of improving function in the body through correcting spinal misalignments or correcting subluxations. And chiropractic works. I mean, it does. I mean, we have what we call limitation of matter. Some people may have had subluxations and spinal conditions in their body for such a long time that the effect that we have is minimal. I mean, as far as whatever aches or pains they come in with, or as far as their arthritis that they come in with. But never lose sight of the fact that whenever you get adjusted, no matter how bad your condition is, we're putting motion in that joint, which is removing irritation on those neural impulses. It's getting the nerve to flow better at the time of adjustment. And then with repetitive adjustments, we're constantly stimulating nerve flow. And that helps your body be healthier too. So chiropractic works. There's a rule of thumb that, we have a 80-10-10 rule. 80% of the people that come to a chiropractor with a condition, musculoskeletal condition, will get the results they're looking for, meaning their aches and pains go away. 10% of the people will have major improvement, but because of limitation of matter, we can't bring stability to that joint, we can't restore balance to the muscle, so they still have ache and pain. And then there's 10% of the people that if they come in with a back pain or a neck pain due to severe arthritis and stenosis and all these other things, we can't really make a difference in that condition. But again, as I said, every time we adjust you, we're putting motion in the spine, which is allowing nerve impulses to flow, and that's helping your body's insides to work better and to function better. And chiropractic works all the time in that avenue. And we had a very one of my major influences in chiropractic was also the president of our university. He started the university back in the 70s. His name was Dr. Sid Williams, and he was a very charismatic healthcare professional. He would give lectures to the student body every week, and his lectures were always about the philosophy of chiropractic and how chiropractic works. And chiropractic works. You just got to give it a chance. Chiropractic does not fail. Chiropractic works. And he would always hammer home his message by reaching into his pocket, and he would pull out a set of keys. And he would say, chiropractic works. Just like me dropping these keys, every time I hold up a set of keys, because of gravity, you know that gravity's going to make those keys drop. It's a given. We drop the keys drop. And that's what his analogy was with chiropractic. Chiropractic works. It always works. It works every time. And people may not realize how it's working in their body, but it works. If you adjust the spine, you're getting irritations off the neural flow, which is improving the nerve impulses. So just like dropping the keys and having the keys drop, gravity works, so does chiropractic. So while in our office we're going to do our best to address, the condition you come here with, the aches, pains, restriction in movement, we're also having an effect on your health. We're also reducing friction on the spine, which is helping the body's degenerative changes from getting worse. But more importantly, again, as I reiterate and I drop the keys, we're taking pressure off the spinal nerves and allowing the nerves to flow the way they're supposed to, which in turn helps you to be healthier. So that's today's health tip. If you have any questions and you would like to learn more about the philosophy of chiropractic and how it impacts your body, don't hesitate to ask me. I am always willing to take a few minutes to talk to you about that. All right? I want you to have a great day today, and I will be in to see you shortly. While we're here, it's in the morning. It's pretty nice out today. It's been very hot and humid. It's still a little humid, but we had a thunderstorm last night, so the humidity dropped a little bit and the temperature dropped. So it's about 75 degrees right now. Feels a little hotter because of the humidity. But you can see it's still a bit of a cloudy day. In the southern direction, see some dark clouds. And based on the way the wind's blowing, it looks to me like those clouds should be blowing towards me and away from me at the same time. So meaning they're going to be blowing north and west. Because if you look north and east, you can see we got some sun shining. So that's a little view today. And again, I will see you soon.